Should someone be resting and recovering after cancer treatment, or should they be active? Is exercise safe? What kinds of exercises are the best ones? And how does exercise benefit someone during and after cancer treatment? Well, my name is Kelly and I am an oncology physical therapist, as well as I specialize in lymphedema and women's health. And in this video, I'm going to go through and answer a lot of your questions that you've been asking on this channel about exercises during and after cancer treatment. So today I'm going to be answering some questions, but in the upcoming weeks and months, I'm going to be sharing workout videos that someone can do at home on their own. So if that is something that you're interested in, be sure to subscribe and hit the notification bell. You can also join us on Instagram for more education and exercise ideas. So let's get started. So as I go through these topics and questions, be sure to remember that although I am a physical therapist, I'm not your physical therapist. So if you have personal questions, you want to check with your doctor or your oncology team for more personalized guidance. So the first question is exercise after cancer treatment safe? There have been plenty of studies out there that have shown the benefits and the safety of exercises during and after cancer treatment. There are research studies that show that moderate to vigorous intensity of exercise, so working really hard, is best done in a supervised setting, so either with a physical therapist like myself or an exercise physiologist or someone that can help monitor for any safety concerns or vital signs. But overall, it shows that there are really low risks of any adverse effects or of any safety concerns coming up. The other thing that we watch for as medical professionals is someone's blood counts. And so we know how to adjust the amount of intensity or type of exercise intervention based on what someone's blood counts are. We're also watching for vital signs such as your blood pressure, your heart rate, and oxygen levels to make sure that everything is in a safe level during your exercises and after as well. So the next question is, does exercise improve fatigue or other symptoms related to treatment? Exercise during and after cancer treatment has been shown in the research over and over and over again that it helps reduce cancer-related fatigue. What may surprise some is that it shows that exercise during cancer treatment is even more beneficial than after treatment to help reduce some of that fatigue. But also it shows that exercise is a better way to reduce cancer-related fatigue compared to something like medication or pharmaceutical drugs. And so anything that we can do to get moving and be active is going to be helpful for fatigue. Exercise can also help improve aerobic exercise tolerance. It can help improve power, strength, lean muscle mass, and also help improve cardiorespiratory fitness. Exercise can also have a positive impact on mood, depression, anxiety, as well as improving quality of life. The next question we're going to talk about is, can exercise help fight cancer? In a way, yes, exercise can have a positive impact on how your body heals and fights cancer. There are studies that show that exercise does have an effect on inflammatory markers in the body. One study showed that exercise reduces serum levels of IGF-1 and IGF-2 in the breast cancer population. An increased level of IGF is linked to breast, prostate, and lung cancers. So by reducing these inflammatory markers and biomarkers in the body, exercise can have that positive impact on the system to help fight cancer. On Mayo Clinic's website, they have an article discussing exercise as a secret weapon. Specifically, it reads, other studies have found that exercise during treatment can actually change the tumor microenvironment and trigger stronger anti-tumor activity in your immune system. And very recent animal studies have found that exercise can lead to tumor reduction in rodents. So there are no studies done on humans at this time to show what the effects are of exercise on the anti-tumor activity, but there is some hope in the progress being made to look into this further. The next question is, what kinds of exercises are best? I'm a big advocate that the best kind of exercise for someone during and after cancer treatment is the one that they can stay consistent with because they enjoy doing it. Yes, there is a lot of research that supports that moderate to vigorous exercise is ideal, like we explained before, but nothing is better than something that keeps you consistent. And so I'm always working with my patients to ask them what is something that they enjoy doing, and we try to work towards that so that they can keep doing that during and after their treatment. If someone is new to exercise or does not enjoy exercise, then the goal is really just to start with a simple walking program or something really basic that they can do each day. But to answer this question a little bit more, high-intensity interval training has been gaining a lot of popularity and a lot of support because of its benefits for cardiorespiratory fitness as well as physical fitness. This is usually done in a supervised setting, like I mentioned before, because we do get into those higher level intensities and we can monitor vitals and for any other safety concerns we might see. Another popular question I get related to what kind of exercise is best is about yoga. Yoga has been looked at a little bit in the research, and it is shown that it's most beneficial if it's done over an extended period of time, such as at least 3 months, to get some sort of benefit. It's been shown that it's more beneficial for anxiety, mood, depression, and quality of life, as well as flexibility, rather than something like cancer-related fatigue, and it doesn't show that it greatly affects the inflammatory markers in the body like we talked about before as well. Next question is, what's better, strength or cardio? I will say one is not necessarily better than the other. The best option is to actually combine the two. The guidelines out there are to try to get at least 150 minutes of moderate exercise or 75 minutes of vigorous exercise each week, as well as strength and resistance training at least 2 times a week. You can also include any balance exercises if needed, and flexibility and stretching as well. Again, a physical therapist in your local area can help create you an individual program to help address any issues that you may have. The last question that we're going to answer today is, can exercise help avoid cancer from returning? Cancer recurrence is a fear that unfortunately a lot of individuals, if not most, have to deal with long term after their cancer treatment. This systematic review looked at 100 studies that involved tens of thousands of individual patients with a cancer diagnosis. Compared with patients who did little to no exercise, patients who did exercise following a diagnosis of cancer were found to have a lower relative risk of cancer mortality and recurrence, and they experienced fewer or lesser effects to the cancer treatment. Specifically, exercising after being diagnosed with cancer is associated with a 21 to 35% reduced risk of cancer recurrence. It's also associated with a 28 to 44% reduced risk of death due to the cancer. So yes, as you can see, exercise has a lot of benefits for someone during and after cancer treatment. Every individual is different in their symptoms and their side effects and their needs. And so reaching out to your oncology team or your physical therapist in your area to help create you a specific program is always the best place to start. If you have any other general topics that you would like to see covered in future videos, be sure to comment those down below. And I'll see you all next week for another video. Thanks everyone.